Hey everyone, welcome again to Visual Med by Liu. My name is Liu, and today I'm going to present these four bone structures called anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, and posterior inferior iliac spine. These four structures are important bone landmarks that can be used for physical examination. Now, if you start from the iliac crest and follow the arch forward, you will find the front end around this point here, and this is the anterior superior iliac spine. And this is a bone protuberance that you can easily palpate just below the waistline and lateral to the belly button. From here, inferior and medially, you will find the anterior inferior iliac spine. Now, if you follow the iliac crest posteriorly, you will find you will feel the posterior superior iliac spine, and is quite often marked by two dimples in the lower back that we call the dimples of Venus. And just below you will find the posterior inferior iliac spine, okay, that is near the upper edge of the greater sciatic notch. Now, these are the four spines of the ilium, okay, and they are not just bumps, they are actually attachment seats and boundaries for muscles and other structures. Now, ASIS, the anterior superior iliac spine, is the point of origin of sartorius and the inguinal ligament. The AIIS, which is the anterior inferior iliac spine, is the origin of the rectus femoris. If you remember, the rectus femoris is one of the four muscles of the quadriceps. Then we have the posterior superior iliac spine, which is the attachment for the sacrotuberous ligament and multifidus muscle. And the PIIS, which is the posterior inferior iliac spine, that helps form the greater sciatic foramen, and which is a critical gateway for nerves and vessels. Now, these four structures are relevant in clinical practice, and we can connect the anatomy to real medicine, and this is what I want to do now. So let's start with the ASIS and PSIS, okay? These define the pelvic ring, which you can draw a line in this situation between the left and the right ASIS, and that is your transumbilical plane, which is roughly at the L4. The midpoint between PSIS marks the S2 spinous process, which is essential for lumbar puncture and works as a landmark in sacral anatomy. Now, nerve blocks and injections are usually applied here in this area. For example, PSIS is an important landmark for the sacral cornua during caudal epidural injections, and miss this actually can cause risk and serious complications. The ASIS, okay, helps locate the femoral nerve, which is 1 to 2 centimeters inferior and medially, and it is critical point for femoral nerve blocks. Avulsion fractures of the ASIS and AIIS are common in adolescents during sprinting or kicking, and this happens due to sudden contraction of sartorius or rectus femoris. And PSIS fractures are rare but can occur in high energy trauma and may signal sacroiliac joint disruption. Now, in surgical procedures, ASIS guides the PIIS incision. I'm sorry if I'm mispronouncing this word. PIIS incision for C-sections of pelvic surgery, made approximately 2 to 3 centimeters above the pubic symphysis, but aligned with the ASIS for optimal access. In posterior approaches to the hip, the PSIS helps avoid the superior gluteal nerve, which exists just above the piriformis near the greater sciatic foramen. And yeah, this is pretty much what I wanted to show you today. And the 4 spines of the ilium are important. They are small, but they are very important landmarks, and they can guide big decisions, important decisions for the physio, or for even for the surgeons. And yeah, this is pretty much what I wanted to show you today. I hope you enjoyed the topic. Okay, remember PSIS, PIIS, PSIS, PIIS, ASIS, AIIS. See you next time. Oh, sorry, my hands are dirty.